So I completed Mia's VB-MAPP, so I'm going to go over the results. Now, she was a little sick today. She had a low-grade fever and a cough, so I didn't see her on her best day. So this is the VB-MAPP scoring guide, and the Manding on level 1. Level 1 is has been field tested with typical kids, the whole VB-MAPP, and level 1 is 0 to 18-month level for typically developing kids. Level 2 goes up to 30 months, and level 3 goes up to 48 months. So Mia is functioning within level 1. However, there are many strengths within this profile that I wanted to point out, as well as where we need to go based on this profile. Another part of the VB-MAPP is the language barrier form, and this also comes into play with most children, especially with Mia, so we're going to go over that. So within the Manding, she only has 2 boxes filled in. She can mand consistently with the words no, go, open, and out. And what I wanted to point out to Mom is that those are more advanced mands. Usually we get mands for candy, juice, doll, those kind of mands first, and then we get mands for no and mands for actions. So while she has few mands, I think Mia has learned over her short life that if she cries and whines and pulls people, she usually gets what she wants. So we're going to have to gradually start teaching her that no longer is going to get her what she wants. When that happens, when she learns, we'll be able to see those manding really expand, I believe. Same goes with tacting. She does a lot of spontaneous tacting on her own terms by tacting the glass with the Dora characters, even in multiple word phrases. I've seen her a few times today tacting things on the TV without anybody asking her what is it. So again, I think although she only has 3 of the 5 boxes filled in, that's an area of strength as well. Listener responding, she was not able to touch her body parts or touch things when directed to do so. Again, I think that's just more of the getting into the language barriers and the problem behaviors, and I think that skill is there. It's just we have to learn how to get it out of her. The verbal behavior match to sample, visual performance match to sample, that is a strength for her. We need to keep working on that. She's in the past, I believe puzzles have been paired with aversion, so she is not liking the puzzles now, so that's a problem, but she's pretty good at matching in general. Imitation, she's not good at currently when you've given her direction, but I have seen her imitate the Wiggles on TV, and so I believe that is another skill that will come fairly easily with some programming. Echoic, again, she echoes all the time on her own terms, but when you sit her down and say ba, say bye-bye, say this, she doesn't. Again, it's an area that we will be able to get, I'm hoping. Play and social is pretty high for a child diagnosed with PDD. So that's a good sign as well. She's not as behind as most kids at this point. And probably because your older son had autism, you were more in tune with the subtle signs, and God help her over here. And vocal is all filled up, and she is babbling. She's saying whole little sentences, phrases. Some I understand, some Mom understands, but she's definitely very vocal. Another great sign. So with these, we're going to really have to worry about getting the skills up by reducing her language barriers. Her language barriers are problem behaviors, which you could see on the video. She is, the least bit of work required, and she's on the floor throwing a full-blown tantrum. Again, instructional control issues. She does have a defective mand, even though she can mand a little bit. She's not consistently manding. Mostly crying and pulling is her way that she mands. Her tacts are pretty strong in comparison. Once we get these 3 barriers fixed, I believe the rest of the barriers will also decrease. Response effort requirements weaken the MO. Basically, if you present the littlest task even for the strongest reinforcer. So most of our effort needs to be on pairing the environment, which is in chapter 4 of my book on pairing. Pairing and manding is really where the focus needs to be for Mia. This article is a good get started with pairing and manding, and then my book, there's blogs on my website, VB-approach.com. If you look at the blogs, there's a getting started blog, there's a reducing problem behavior blog. That's where we need to go. When these go down on the next administration, these will invariably go up. We'll start to see progress. The main guide in the VB-MAPP also has a section where we can pull specific goals based on her VB-MAPP protocol, which we'll do, and that can be incorporated with IFSP goals, IEP goals, everybody on the same team working on the same goals.